Hello. This is just a review of your insulin lecture. Okay, so insulin is a hormone that is produced by the pancreas that helps to regulate blood sugar. So in this lecture, in this review, we'll go over the different types of insulin, and we'll talk about the onset, the peak, and the duration. Then of course we'll talk of signs and symptoms of hypo and hyperglycemia. So these different types of insulin, as I said earlier, they are classified based on their peak, their onset, and their duration. So starting from the top, we have our rapid acting insulin. Under it, we have Lispro and Aspart, which is most commonly seen. So the onset for Lispro, the onset for Aspart, any rapid acting insulin will be 15 minutes. So the key thing I want you to remember is that give this insulin when actually the patient has taken a first bite of their meal, okay, because it start working in 15 minutes. So it's not like the patient is planning to eat and then we'll decide to give this. No, when they actually take their first bite, we're going to give this insulin. So that's when we expect the onset. Then it will peak anywhere from 1 to 2 hours. Then of course duration, how long it's going to last in the system, will be 3 to 4 hours. So if we give a rapid acting insulin at 7:30, we expect the onset to start working at 7:15, and then we expect peak anywhere from 8 o'clock. So bear that as you work with this insulin. Then the short acting insulin, this is the insulin for the onset is going to be 30 minutes to an hour. Okay, so same process. All right, so peak is 2 to 3 hours, and then duration is 3 to 6 hours. Example of a short acting insulin is going to be your regular insulin. Intermediate acting is just as the name says. Okay, so peak 2 to 4 hours, peak onset 2 to 4 hours, peak 4 to 12 hours, duration is 12 to 18 hours. Then the long acting insulin, most common one we see often is Lantus, Levomir, Detamir. With there's no peak, but the onset is 1 to 2 hours, and then duration is 24 hours insulin. There's something I want to say about Lantus. Lantus is your 24-hour insulin. So there's not a time that we will say we want to hold this insulin because the patient is MP or nothing to eat by mouth. Okay, so if the patient is going for a procedure, follow your physician's order. Okay, sometimes they'll say give half of the dose, sometimes they'll say give it, because remember this is a 24-hour insulin, so you don't want to hold it. Okay, you don't want to hold it. And sometimes if your patient's blood sugar is low, then of course give them something to eat. Talk to your physician. If you're holding Lantus, make sure you have the physician's order to hold it. So feed your patient, give them something to eat. So in a situation where they absolutely cannot eat anything, then you can consider holding it until you talk to the physician. Okay, then we'll switch gears right to when do we give this insulin and when do we not give insulin. If a patient is hypoglycemic, again, you don't want to give a patient insulin if they're hypoglycemic. Say if a patient's blood sugar is in the 40s, okay, you don't want to give them any kind of insulin. All right, so these are some of the symptoms you'll see for in your patient. I use the acronym here is low and tired. So they are lightheaded. Okay, they feel like their lightheadedness, obtunded, so meaning they're confused, weakness. You notice your patient is shaky, trembling, irritability, rapid heart rate, excessive sweating, they're dizzy. So the patient just feels sick. These are some of the signs and symptoms of hypo. The hyperglycemia, where blood sugar is high, so we can give insulin. The blood sugar is high because we want the insulin to be able to regulate the blood sugar, right? So here is your symptoms will be high and sweet. For acronyms for this will be hot and dry skin, increased thirst, glucose in the urine, hunger, so the patient is excessively thirsty, they are hungry, slow healing wound healing. Yeah, so for the slow wound healing, you won't see that immediately, but this is a patient that has been sustaining high blood sugars for a long period of time. Okay, weight loss, excessive urination, extreme fatigue, and thirst. So let's test our knowledge on, okay, which symptom is commonly associated with hypoglycemia with a patient with diabetes mellitus. A. Increased urinary output. B. Rapid weight gain. C. Hypotension. And D. Hypothermia. Yes, if you choose A, increased urinary output, you're right. A 55-year-old female with a history of diabetes, type 2 diabetes, is admitted to the medical surgical unit for management of hypoglycemia. The client's blood glucose level on admission is 420. The healthcare provider prescribes an insulin infusion to control the client's blood sugar, which action by the nurse requires immediate intervention. So, of all these choices, which do you think requires the nurse to intervene? Because the goal is that we want to manage this blood pressure. So is there any answer choice here that will slow down, is there any answer choice here that you think can help us to be able to effectively take care of this patient? Okay, so let's read the choices. Assessing the client's vital signs. Yeah, that's good. Administering regular insulin via subcutaneous injection. Okay, initiating a sliding scale insulin regimen based on blood glucose reading, increasing the insulin infusion rate as necessary to maintain blood sugar target. So this is a patient with 420 blood sugar on admission, and they are scheduled to have an insulin infusion. So when we see insulin infusion, we should be thinking IV, okay, and infusion. So of all these choices, if this win for regular insulin, okay, for regular insulin, which is the most common, that's what is used for IV infusion. Yes, let me make that clear. So we use regular insulin, which is the short-acting insulin, okay, IV. This is the best option for IV insulin. And if you look at your choices, the only thing that has regular insulin is B. The right answer is actually B. And the rationale for B is because since the sugar is already high, we want to try to start bringing down this sugar as fast as possible. Subcutaneously, the physician wants an infusion. So why are we going to do it subcutaneously? So this will be a call for concern. Okay, we want this IV. So I'll take immediate action if I see anyone trying to do this subcutaneously, because this will not manage my patient's blood sugar fast and effective. It will not be effective to be able to start bringing down this high blood sugar. So like see, here's a rationale. Okay, the management of hypoglycemia. Okay, the use of subcutaneous regular insulin injection is not appropriate for clients with blood sugars level as high as 320. Regular insulin is commonly used to correct elevated blood sugar levels, but it has a lower onset and peak action compared to IV. Okay, so we want to do IV because IV is actually faster, and our sugar was 420. So that's why we're going to intervene If somebody's trying to do it sub-Q, we want to do it at a 66-year-old male client with a history of diabetes type 2 is admitted to the medical surgical unit. The client's blood glucose level is 58. The nurse finds the client diaphoretic, shaky, and confused. Which action should the nurse take first? So this is a patient with low blood sugar. Okay, remember we said the low blood sugar, the sweating, okay, and they're shaky and they're confused. All right, so what do we want to do first? A, administer dextro IV as prescribed. B, obtain a finger stick blood glucose. C, offer the client with a glass of orange juice. D, perform a thorough neuro assessment. So this is hypoglycemia. We want to give fast acting carbohydrates. Specifically, we can 15 grams. That seems like the magic word. So orange juice. So C, we want to do orange juice. Okay, to correct that blood sugar, so we'll do orange juice. So then we'll stop right here and then we'll continue with our case study.